She is cardiology extraordinaire, and she is here to talk to us about heart health.
Okay, so in thinking about what to talk about today, this is my second time. You've had this for 9 years. I've only been here. This is my second time. I'm not going to say anything about that. But in trying to think about what I can talk about, and I know I only have 15 minutes and I talk pretty fast, I really wanted to go back to the basics. And my husband wanted to call it the anti-Google lecture, right? Because it's things that you don't Google, because Google is very complicated now, and you can look up everything and anything. But I think these things we forget about. So I really want to go back to the basics a little bit. Okay, so, I have a lot of patients who come to me and they want to prevent heart disease, right? That's their number one question. They don't have anything wrong, they just want to prevent it. They don't want to have heart disease. They have it run in their family, and they say, what can I do? Well, let's just talk a little bit about what it is and what causes it. So in the United States, 1 in 4 deaths are due to heart disease. It's the leading cause of deaths in both men and women, and coronary artery disease is the most common type of heart disease. 735,000 patients per year have a heart attack, and 525,000 are first heart attacks, which mean that the rest of them are second heart attacks. The other things that we talk about are atrial fibrillation. It affects quite a few people. Okay, 2.7 to 4.1 million people. 9% of people aged 65 years or older have AFib, and that increases with increasing age. And this in itself causes 15 to 20% of strokes. And this is probably underestimated because many patients come into the hospital with a stroke and we don't know why they had a stroke. And a lot of times it's because of atrial fibrillation. So, when we talk about risk factors for heart disease, we talk about age, genetics, hypertension, high cholesterol, smoking, diabetes, overweight, obesity, physical inactivity, excessive alcohol use. I just want to point out, sorry, I thought that was a laser pointer. I just want to point out hypertension, high cholesterol, and smoking. 50% of Americans have one of those 3 risk factors. I mean, that's a lot, right? Now, age and genetics, we can't do much about, but the rest of these things we have control about. Now, hypertension in itself, statistics are probably underestimated because many people walk around without them knowing that they have hypertension. So 1 in 5 patients are unaware that their blood pressures are high. 54% of hypertensive patients have it under control. And even if you treat hypertension, patients who have a diagnosis of hypertension have an increased risk of cardiac events and death compared to those who never develop hypertension. So, when we talk about what we can do, like I said, age and genetics, we're stuck with it. As much as my husband thinks we can do something about age, right, Jody?
He's a plastic surgeon.
He's a plastic surgeon, right? We can't do anything about age, okay? Sorry. He hates it when I make fun of him. But anyway, but hypertension, all these things we have control over, like 100% control over. When potato salad goes bad. Now, I've always liked Far Side. So when we talk about diet, you'll read about a different diet all the time. You know that now there's a ketogenic diet, there's all sorts of things that come up. When they've done studies on a lot of these diets, they really have variable improvement of LDL, but they all reduce hypertension and they are all associated with weight reduction. Right now, the big thing for the ACC, or the American College of Cardiology, is a Mediterranean diet, okay? Now, when we talk about the cellular changes that happens with a good diet, we're talking about the heart arteries and the cells that line the arteries. We're talking about the endothelium, right? And we know that the endothelium behaves very poorly when it's exposed to bad things, whether it's smoking, whether it's diet. But if we give it a good diet, then it does what it's supposed to do. Meaning, when you exercise, it opens up and it allows more blood flow. Whereas if you expose it to bad things when you exercise and get stressed, it constricts, okay? So what we want to do with diet is we want to decrease inflammation as much as we can. We want to improve endothelial function. We want to decrease the accumulation of plaque that builds up in the wall. So why is inflammation so important, and what sort of can we do to decrease inflammation? Well, the things that we can do that are in our control is we can eat healthy, We can exercise, and what we're recommending is 150 minutes moderate of exercise. That means, I know how we all love to walk our dogs, but you know that the dogs kind of walk us, right? We don't really increase our heart rate when the dogs walk us. We need to increase our heart rate for 150 minutes a week. So that's 30 minutes for 5 days. And I always say that's really not that much, 30 minutes, right? It's like Three's Company. 30 minutes. That used to be my favorite show growing up, right? So it's not that long, but you have to give yourself time to do something to increase your heart rate. What increases inflammation? Junk food, sugar, trans fats, stress. And we all have stress in our lives. Acute versus chronic stress. Chronic stress meaning work-related stress. There are studies showing that people who work in job situations where they feel like they don't have any control and they have this chronic stress, they have an increased risk of a heart attack. Okay? Depression. Depression has been associated with heart disease, especially in patients who've already had an event. This increases the second event of a heart attack. Smoking, drugs, okay? And alcohol is very dose dependent, right? A small amount of alcohol has been shown to be helpful to us, but if you increase it too much, it actually increases inflammation and increases problems with our heart. So the reason plaque is so important is this picture here. And just to really explain, this comes up a lot as to, I don't understand how I could have had a heart attack when I had no symptoms. Or how could I have a heart attack when I did a stress test a week ago and I passed that stress test, okay? This has to do a lot with inflammation. So if you look at a plaque, the plaque, I wish I had a pointer, so I apologize, but the plaque has a cap on it, all right? And that cap can either be nice and thick and stable, or it can be thin. And that plaque itself can be sort of fatty and immature and likely to sort of be irritated and rupture that plaque cap, or it can be fibrotic and it can just sort of sit there for years and years and never cause a problem. The problem is plaques that rupture, these highly inflammable plaques, can be only 40 to 50%. So it's never going to cause you a symptom when you exercise. It's never going to cause a positive stress test. But if you get enough inflammation within that plaque and that plaque ruptures, it will be exposed to the bloodstream and you're going to form a blood clot and have a heart attack. So that's how you can have a heart attack with never having any symptoms before. And that's why inflammation plays such a big role in sort of heart attack. And that's why we always talk about decreasing inflammation by some of the things we do in the diet, as well as some of the medications that we sort of force upon you, okay? So exercise in itself has been shown to decrease inflammation. How do we know that? Because we do blood tests and we can check inflammatory markers and we can see that these inflammatory markers decrease. But exercise also relieves stress. I know that if I don't exercise in the morning, I am not a very nice person by the end of the day, right? I am much better, I am much happier if I do my workout in the morning. It improves your mood. They've done cardiac rehab studies post-heart attack, and they see that this in itself is a huge predictor of how patients do in the future, okay? The other thing is, exercise, like I tell my patients, if you exercise every day and something changes in your exercise pattern, then I know that something is going on in your heart. If you sit on the couch every day, you are never gonna know if something is going on with your heart. You're just never gonna feel anything different. Whereas if you push yourself and you work out every day, you'll know if one day you can't walk those 2 blocks the same way that you did a month ago. So that's really important for me. I ask that, I ask about patients' exercise tolerance all the time. This also decreases other risk factors such as hypertension, metabolic syndrome, or diabetes, okay? If you exercise, you decrease other risk factors, all which promote heart disease. Stress. We also know that stress increases inflammatory markers in the blood. We've done studies on people, not patients, watching football games, right? And they'll see that if they take blood tests and they know that they're stressed about their game, those inflammatory markers go up. Stress management has been shown to help reduce the risk of heart attacks. Workplace studies showing the feeling of helplessness has been shown to increase stress overall and increase cardiac events. Finding healthy coping mechanisms is really very important for us to reduce both the end point of having a heart attack, but also the development of coronary artery disease. So I get that this is sort of something that you guys know, and patients always sort of say, well, I know that. I said, well, I know you know that, but you got to do it, right? I mean, that's the big difference. We all know it, but we have to do it. So in this room, right, those 3 risk factors, smoking, right, hypertension, all this. Who has hypertension in this room? Or who knows they have hypertension in this room? Okay? And of all the other people, have we checked your blood pressures regularly? Right? So the other thing about hypertension, which is interesting, is you'll read about how there are studies saying, well, you should sit, find a calm place, then check your blood pressure. Just to let you know, to me, I would much rather know what your blood pressure is at a random time. If you're always sitting and relaxing, that's great, but that's not what we do in our lives, right? We're constantly moving, we're constantly stressed. We need to treat our blood pressure when we're constantly moving, when we're constantly stressed. And that's why it's important to check random blood pressures throughout the day, not just after 15 minutes of meditation and yoga, okay? So, back to the basics, I would say, this is my challenge to you, okay? Decrease your salt intake. Who eats a lot of salt? Who watches salt in their diet? Was that a decrease or who eats salt? Right. Okay, so wait, who watches their salt in their diet? Okay, who's really good about watching their salt in their diet? Okay, who goes out to eat? Really? Right. So one day of eating or one meal in a restaurant is enough for 3 days worth of salt. Okay? So for all of us who try to watch our salt, you can't do it when you eat out. You just can't. Ooh, sorry. Let me go back. Okay? So my challenge is you've got to watch your salt, which means, unfortunately, you cook at home. You got to stop the snacking, because that's where the calories sort of count up without us even knowing. Don't procrastinate. It's like what I do sometimes when I don't feel like exercising. Just do it. Don't even think about it. Just do it. Drinking while cooking. Who does this? Yeah, I know, that's the worst, right? Because all of a sudden that 1 glass becomes 2. So I think we have to be really careful about that. With women, we have to be super careful. The data shows that 1 glass is okay. But once we exceed that, we start running into problems. Reading on a stationary bike. Who does that? Okay, you can't get your heart rate up. You got to get your heart rate up when you exercise. Supersize. This is like the American dream. I just came back from Spain. They don't have supersize there. Okay? Work excuse and retirement excuse. This is my favorite. I have patients who say, I work so much I can't exercise, but when I retire, I'm going to start my exercise. And then they retire, and you know what they tell me? I'm so busy, I don't have time to exercise. And I don't know how that's possible, but this is what I hear. So, some of the things we can do. Find an exercise buddy, okay? It's been shown that socialization with exercise really helps. Exercise before work, because when you get home from work, there is no way anyone's going to want to put sneakers on and do something. Do it before work. Take a smaller plate when you go to dinner. You know, just force yourself. Take a dessert plate, and that's what you're going to have as your portion size. Calories in has to be less than calories out, or else you will never lose weight. Socialize during meals. Maybe talk a little bit so we don't eat all the time. And I would say, give yourself 2 weeks to do these things, and you'll find that you'll make a difference, and you'll feel better, and you'll want to continue it. Okay? So I know this isn't anything new, but I will tell you that this is the most important thing you can do to improve your lifestyle. It's not any test that I can offer you. It's not even all the medications that are all fancy and new on Google that you can read about. You've got to first start with your lifestyle. Okay? So, thank you.